Hi friends, my name is Nandita. I am from Andhra Pradesh.
Good morning dear students. Today we are going to discuss about control and coordination from chapter 7 class 10 CBSE syllabus. And children, now let us discuss about endocrine system. The endocrine system is composed of several endocrine glands. A ductless gland is called endocrine gland. Endocrine gland secretes its product directly into the bloodstream. Hormones are produced in the endocrine glands. Hormone is mainly composed of protein, and hormone assists the nerve system in control and coordination. Nerves do not react to every nook and corner of the body, and hence hormones are needed to effect control and coordination in those parts. Moreover, unlike nerve control, hormone control is somewhat slower. Children, now let us discuss about endocrine gland. A ductless gland that secretes hormone directly into the bloodstream is called endocrine gland. The human endocrine system is made up of a complex network of glands that secrete different hormones in the human body. Hormones are produced, stored, and released via the endocrine glands in human beings. Each gland produces one or more hormones that target specific organs and tissues in the body. Children, now let us discuss the functions of human endocrine system. The human endocrine system regulates a variety of body functions through hormone releases. The hormones are produced by the endocrine system's gland and pass through the bloodstream to different organs and tissues in the body. Hormones then instructed these organs and tissue about how to act. The endocrine system is controlled of the following body functions like metabolic rate, development and growth of human being, reproduction and sexual function, heart rate, blood pressure, the appetite, that is the need to eat, controls the cycles of sleep and wakefulness, controls the temperature of the body. Children, now let us discuss about endocrine system hormones. In this section, we will learn about some of the hormones in the human body which are secreted by endocrine glands, and these hormones are chemical messengers secreted in very small amount of specialized tissue called ductless glands. They act on target tissue organ usually away from their source. Endocrine system helps in the control and coordination through chemical compounds and are called hormones. Children, this is a flowchart of glands that is secreted by endocrine system and hormone under which organ it is targeted and function. Let us go through with the chart. The pineal gland, which is secreted by endocrine system, and a hormone is released as melatonin, and targeted of organs are many. Functions is biological clock. Next come to the pituitary gland. Pituitary gland secretes the hormone like FSH, LH, ADH, growth hormone, oxytocin, prolactin, etc. and organs, it targets the organs like ovaries, kidneys, many others, and uterus, breast tissues, etc. The functions of this pituitary gland affects on menstruation cycle, osmoregulation, growth and division, birth contraction, milk production. Let us look into the thyroid gland. Thyroid gland secretes thyroxine hormone and it targets the organ liver, and function is metabolic rate. Next come to the adrenal gland. The adrenal gland secretes adrenal hormone or cortisol hormone, and it also targets many organs, and its main function is fight or flight, anti-stress. Next one is pancreas. Pancreas secretes insulin and glucagon hormone, and it targets the liver, and function is to maintain the blood sugar levels. Next one is the gland which is secreted by endocrine system is ovaries, and hormone produced by the ovaries are estrogen and progesterone, and target the organ is uterus, and functions like menstruation cycle. And next one is testis gland. Testis gland secretes testosterone hormones and targets many organs, and functions as male characteristics. Children, now let us discuss the list of all important endocrine glands in the human body are as follows. Hypothalamus. The hypothalamus is the part of the brain that houses a number of small nuclei that performs various functions. One of the hypothalamus' most essential function is to connect the nerves and the endocrine system via the pituitary gland. The limbic system includes the hypothalamus, which is situated under the thalamus. The hypothalamus is in charge of regulating certain metabolic process as well as other autonomic nerve system behaviors. It produces and secretes certain neurohormones known as releasing hormones or hypothalamic hormones, which stimulate or inhibit the pituitary gland hormone secretion. The body temperature, appetites, essential aspects of parenting and attachment behavior, trust, fatigue, sleep, and circadian rhythms, and all regulated by the hypothalamus. Now let us discuss about pituitary gland, which is also called as human body master gland. The pituitary gland, which is the master gland of the human body, also known as the hypophysis, is a small endocrine gland that weighs about 0.5 grams and is about the size of a pea. Since it regulates the activity of many other endocrine glands, the pituitary gland is known as the master of the human body. It's a protrusion at the base of the brain and that protrudes from the bottom of the hypothalamus. Hypophysis is found in the center of the middle cranial fossa on the hypophyseal fossa of the sphenoid bone and is enclosed by a narrow bone cavity filled with a buccal fold. The anterior pituitary, also known as the adenohypophysis, is lobe of pituitary that controls stress, development, reproduction, and lactation. The pituitary gland secretes hormone that regulates development, blood pressure, energy balance, all sex functions, all sex organ functions, thyroid gland function and metabolism, as well as some aspects of pregnancy, childbirth, breastfeeding, water salt concentration in kidneys, temperature regulating, and pain relief. Children, let us discuss the symptoms of pituitary gland problems. Vision problems such as blurred vision or loss of side vision, headache, dizziness, numbness or pain in the face, sleep problems, fatigue, weakness, nausea, etc. Children, let us discuss in detail about hormones produced by pituitary gland. First is growth hormone. Growth hormone, also known as human growth hormone, HGH. This hormone helps build bones and muscles and influences height. Next, adrenocorticotropic hormone. This hormone triggers the adrenal glands to release cortisol, which helps to regulate blood pressure, metabolism, and blood sugar levels. Next one is follicle stimulating hormone. This hormone stimulates the ovaries to produce estrogens and can help mature ovarian follicles. In men, it stimulates sperm production. Luteinizing hormone. This hormone stimulates ovulation in people assigned female at the birth and testosterone production in people assigned male at the birth. Prolactin. This hormone stimulates breast milk production after giving birth. It also contributes to breast tissue development. Thyroid stimulating hormone. This hormone stimulates the thyroid to produce hormones that manage metabolism, energy levels, and nerve system. Children, now let us discuss about follicle stimulating hormone FSH. The pituitary gland secretes follicle stimulating hormone FSH. The follicle stimulating hormone FSH is a hormone that affects sexual development and reproduction in both men and women. It produces in the pituitary gland. FSH aids in the regulation of the menstruation cycle in women and promotes the development of eggs in the ovaries. Women's FSH levels fluctuated during the menstruation cycle, with the maximum levels occurring right before the ovaries release an egg. This is referred to as ovulation. FSH aids in the regulation of sperm's production in males. Let us see how FSH works. In females, FSH helps with ovulation and the menstruation cycle. It stimulates the growth hormone of follicles in the ovaries and prepares them for ovulation. FSH levels vary throughout the menstruation cycle and are highest just before ovulation. FSH in males stimulates the production of sperms. It also maintains the function of fertile cells in the testes. FSH test. Let us see how FSH test. FSH test can diagnose conditions that cause too much or too little FSH. For women, FSH test can help diagnose infertile, menstrual irregularities and menopause. FSH test can also determine when a woman is most likely to get pregnancy. Now children, let us see the levels of FSH. Normal FSH levels vary by age and sex. For example, before puberty, normal FSH levels are 0 to 5.0 ml, while during puberty they are 0.3 to 10.0 ml. High FSH levels in women can indicate a loss of ovarian function, menopause, or polycystic ovarian syndrome. Children, now let us discuss about luteinizing hormone. Luteinizing hormone is released by pituitary glands and it is important for sexual development and function. LH aids in the regulation of the menstruation cycle in women. It also causes an egg to be released from the ovary. It is referred to as ovulation. Luteinizing hormone LH is a hormone that regulates sexual development and fertility. It produced by the pituitary gland, already we discussed that, and released into the bloodstream. Let us see how does it works in women. LH triggers ovulation and the release of progesterone. LH levels peak around the middle of the menstruation cycle. In the men, LH causes the testosterone to produce testosterone, which is needed to produce sperm when LH levels change. In children, LH levels are high after birth, then drop until puberty. In women, LH levels vary throughout the menstruation cycle. After menopause, LH levels increase. In men, low LH levels can be a sign of late puberty, which high levels can be sign of earlier puberty. Let's see testing of LH. LH test measure the amount of LH in your blood. This test can also help diagnosis conditions that affects the ovaries, testes, pituitary gland and hypothalamus, and this test can also help to determine the causes of infertility. Let us discuss about oxytocin hormone. Oxytocin is secreted by pituitary gland. The function of oxytocin in female reproduction is well known. It is released in the significant quantities during labor and after nipple stimulation. This use of oxytocin as a medicinal agent during labor and childbirth is one of the oldest use of oxytocin as the medicine. The pituitary gland stores and releases oxytocin into the bloodstream. The hypothalamus produces oxytocin. The oxytocin is a hormone that plays a key role in the reproductive system and human behavior. It is also known as love hormone because it promotes positive feelings. The hypothalamus is the part of the brain that produces this oxytocin and pituitary gland that stores and releases oxytocin into the bloodstream. The posterior pituitary gland stores oxytocin in the pars nervosa, also known as the neural or posterior lobe. The posterior pituitary gland that stores and releases oxytocin hormones. And let us discuss the functions of oxytocin. The main function of the oxytocin is reproduction. Oxytocin increases contractions during labor and birth and releases milk after the birth. And behavior of this hormone is influence social recognition, relationship formation and love emotional attachment. It also helps low stress and anxiety and build trust. That is the reason it called as love hormone. Let us discuss the conditions that affect the posterior pituitary gland. First one is hypersecretion. Too much of oxytocin is released, that is called hypersecretion, and hyposecretion is too little secretion of oxytocin. And tumors can also affect the posterior pituitary gland, but they are rare. Children, now let us discuss about another hormone which is released by pituitary gland. It is called prolactin. Prolactin is involved in hundreds of psychological activities, but two of the most are milk production and the growth of mammary glands in breast tissues. Prolactin encourages the development of mammary alveoli, which are the components of the mammary gland where the milk is produced. Prolactin is a hormone that helps the breast development and lactation. A blood test can be measured prolactin levels to help diagnosis conditions of a prolactin tumor. The prolactin levels are in men less than 20 per milliliters, and non-pregnancy in women the prolactin levels are less than 20, and when pregnant or breastfeeding it is about 80 to 40 ml. Let us discuss what can cause high prolactin levels. Some medications can affect dopamine production, which can increase prolactin levels. This includes childbirth control pills, antipsychotics, high blood pressure medications, and more. Health conditions. Some health conditions can cause high prolactin levels, including kidney diseases, hyperthyroidism, liver failure, and polycystic ovarian syndrome, etc. Let's see how is prolactin test performed. A doctor can provide information or any special preparation needed for the test. For the best accuracy, blood is drawn 3 to 4 hours waking up in the morning. In some cases, patients may need to be fast before the test. Children, now let us discuss about pineal gland. The pineal gland, also known as the epiphysis cerebrin, is a small endocrine gland found in most vertebrates' brain. Melatonin, a serotonin derived hormone produced by the pineal gland, regulates sleep patterns in both circadian and seasonal cycles. The pineal gland is tucked in a groove where the two halves of the thalamus meet in the hypothalamus near the middle brain between the two hemispheres. The pineal gland is a neuroendocrine secretory circumventricular organ with capillaries that are largely permeable to blood solids. Melatonin production is the pineal gland primary role. Melatonin functions in the nervous system in a variety of ways, the most important of which is to help regulate sleep patterns. Darkness stimulates melatonin development while light inhibits it. Children, now let us discuss about melatonin. Melatonin is secreted by pineal gland. Melatonin is a hormone of darkness that mediates dark signals and provides night information rather than being a sleep hormone. It also thought to be an endogenous synchronizer, stabilizing and reinforcing the body various circadian rhythms. The pineal gland is a small gland in the brain that produces melatonin, a hormone that regulates sleep and circadian rhythms. Let's see what is melatonin. Melatonin is a hormone that's present in small amount of living things. It helps to regulate other hormones. Melatonin can be made synthetically in a laboratory and hold as a dietary supplement. What does this pineal gland do? The melatonin is produced by pineal gland, which helps to regulate the body internal clock and sleep patterns. Melatonin production is a link to the light-dark cycle, with the highest levels of produced at night. Melatonin helps to coordinate the body psychologically and behavioral adaptations of the day and night seasons. Thyroid gland. The thyroid gland is a butterfly-shaped endocrine gland in the neck that produces hormone that regulates metabolism, growth, and development. A thin band of tissue called thyroid isthmus connects the lower two-thirds of the lobes. The thyroid gland is found below Adam's apple in the front of the neck. The peripheral thyroid follicle, lined with follicular cells and occasional parafollicular cells that surrounded a lumen containing coil, is the function unit of the thyroid gland. The thyroid gland produces three hormones, iodothyronine and thyroxine are the two thyroid hormones that are created from iodine and thyroxine and calcitonin, a peptide hormone. The thyroid hormones affects metabolic rate and protein synthesis as well as growth and development in infants. Calcium homeostasis is supported by calcitonin. Thyroid hormones modulate DNA transcription by crossing the cell membrane and binding to nuclear thyroid hormone receptors. The thyroid hormone also functions within the cell membrane or cytoplasm through reactions with enzymes such as calcium epitase, adenyl cyclase, and glucose transporters in addition to their actions on DNA. Iodized salt is necessary because iodine mineral is essential part of thyroid hormone. So it is important we must consume iodized salt, as in turns it is essential for thyroid gland as it controls carbohydrate, proteins and fat metabolism. For best balance of growth, deficiency of iodine may cause disease called goiter. Children, thyroid gland produces hormone that controls the body metabolism. However, the body uses energy. The growth and development, the thyroid gland produces hormones that stimulate somatic and physic growth. Calcium metabolism. The thyroid gland produces calcitonin, which helps regulate blood calcium levels. The T4 is an inactivate thyroid hormone and T3 is an activate thyroid hormone. Thyroid disorders are very common and can affect anyone, but mainly occurs in women. These disorders can be temporary or permanent and include an overactive and underactive thyroid. Children, let us discuss about parathyroid gland. Humans and others tetrapods have tiny endocrine glands in their necks called parathyroid glands. The parathyroid glands are a group of small glands in the neck that produces parathyroid hormone, regulates calcium levels in the body, which are important for muscle and nerve functions. Humans have 4 parathyroid glands, which are commonly found on the neck of the back thyroid gland in different places. In response to low blood stream, the parathyroid gland produces and secretes the parathyroid hormone, which plays an important role in controlling the amount of calcium in the blood and bones. The primary function of parathyroid gland is to keep calcium and phosphate levels in the blood within a small range so that the nerve system and muscular system can work properly. This is accomplished by parathyroid gland secreting parathyroid hormone. Children, the main function of parathyroid gland is to maintain the calcium levels, that is PTH controls calcium levels in the blood by stimulating the release of calcium from bones, the absorption of calcium from food and the conservation of calcium by the kidneys. Another function is to produce vitamin D. The parathyroid hormone helps to active vitamin D, which helps the intestine absorption of calcium. Children, let us discuss the disorders of parathyroid. First one is hyperparathyroidism. When the blood produces too much of PTH, which leads to high calcium levels in the blood, is called hyperparathyroidism. Second one is hypoparathyroidism. When the blood produces too little PTH, which leads to low calcium levels in the blood. Children, let us discuss about parathyroid hormone. The parathyroid hormone is secreted by parathyroid gland. The parathyroid hormone causes the bones to release calcium into the bloodstream. The intestines absorb calcium from the food and the kidneys conserve calcium. The parathyroid hormone gland refers to as parathyroid glands, which are 4 tiny glands located behind the thyroid gland in the neck, responsible for production parathyroid hormone that regulates calcium levels in the blood by signaling the bones to release calcium when levels are low. Essential, the parathyroid glands are the only glands that secreted parathyroid hormone. Let's see the key points of the parathyroid glands. The function of parathyroid glands, already we discussed that it regulates the calcium levels in the blood by releasing parathyroid hormone. Location is situated in the posterior surface of the thyroid gland in the neck, and hormone produced are PTH. When blood calcium levels drop, the parathyroid gland releases PTH, which stimulates the bone to release calcium into the bloodstream and also signals the kidney to reabsorb calcium. Children, let us discuss about the thymus gland. The immune system thymus is a specialized primary lymphotic cells or T cells grow within this thymus. T cells play a crucial role in the adaptive immune system, which allows the body to respond to foreign invaders. The thymus is found in the anterior superior mediastinum behind the sternum and in the front of the heart in the upper front portion of the chest. It constitutes of two lobes, each within a central medulla and outer cortex, and it is enhanced in a capsule. Children, now let us discuss about adrenal gland. The adrenal glands are a pair of small triangular shaped glands located on the top of each kidney. They produce hormones that regulates many important bodily functions including blood pressure, heart rate and metabolism. The adrenal glands are also known as suprarenal glands or endocrine glands that contain adrenal and the steroids, aldosterone and cortisol among other hormones. Children, let us discuss the parts of adrenal glands. Adrenal cortex. The outer layer of adrenal gland that produces steroid hormones is called adrenal cortex. Adrenal medulla. The central of the adrenal gland that produces catecholamines such as epinephrine and epinephrine. Hormones that produced by adrenal glands. Cortisol helps regulating the body's response to stress. Aldosterone helps regulates the body pressure and salts and water levels. Epinephrine, catecholamine that helps regulates the body response to stress. Norepinephrine, catecholamine that helps regulates the body's response to stress. These are the hormones which are produced by adrenal glands, and testosterone also a hormone that produced by adrenal glands in small amounts. Children, let us discuss the disorders of adrenal gland. An adrenal insufficiency caused by Addison's disease occurs when the adrenal gland do not produce enough hormones. Nodules. Nodules can be benign or malignant and can produce excessive amount of hormones. High cortisol levels can cause upper body obesity, fatigue, high blood pressure, diabetes and more. Children, let us discuss about adrenaline hormone. An adrenaline known as epinephrine is secreted by adrenal gland. Adrenaline is also known as epinephrine is a hormone that helps the body to respond stressful or dangerous situations. It released by the adrenal gland which is located above the kidneys. The adrenaline main effects involving raising heart rate, blood pressure, widening lungs for air passages, enlarging the pupil in the eye, redistributing blood to muscles and charging the body's metabolism to maximizing the blood sugar levels mainly for the brain. Children, let us see how this gland works. When the brain detects stress, it sends signals messages to the adrenal gland. The adrenal gland releases adrenaline into the bloodstream. The adrenaline causes a number of changes in the body, including faster the heart rate, faster the breathing, increased blood pressure, increased blood sugar levels, increased alertness, large pupils, sweating, reduced pain. Children, let us see when it releases the hormone. When adrenaline is released during short-term stress such as fear or sudden shock, it can also be released in response to anxiety, worry or thoughts. Let us see which medicine is used for this adrenal released hormone. Adrenal is used as a medicine to treat conditions like cardiac arrest, allergic reactions and superficial bleedings. It can also be used to treat asthma and cough. Let us see the side effects of this hormone. The adrenal can cause side effects like anxiety, shakiness and sweating. It can also cause a faster heart rate and high blood pressure. Children, now let us discuss about aldosterone hormone. This aldosterone hormone is a steroid hormone secreted by the adrenal gland. Aldosterone is a hormone that helps to regulate blood pressure and fluid balance in the body. It produced in the adrenal gland which sit on the top of the kidneys. The main function of the aldosterone is to control salt and water in the body, thus influencing blood pressure. Children, now let us discuss how this aldosterone hormone works. This aldosterone helps balance sodium and potassium levels in the body. When the blood pressure is low, aldosterone signals the kidney to retain sodium and secrete potassium. This increases the amount of water in the bloodstream, which increases the blood pressure. When blood pressure returns to normal, aldosterone levels decreases. Children, let us discuss what happens when aldosterone levels are abnormal. Too much aldosterone can cause high blood pressure and low potassium levels, and too little aldosterone also can cause impact on the health. Children, now let us discuss how is aldosterone measured. An aldosterone test measures the amount of aldosterone hormone in your body or by urine. Children, now let us discuss what conditions are associated with abnormal aldosterone levels. Like hyperaldosteronism is a condition associated with abnormal aldosterone levels, symptoms including high blood pressure and low potassium levels. Children, now let us discuss another hormone which is called cortisol. This cortisol is a steroid hormone secreted by adrenal gland. Cortisol is a hormone that helps the body respond to stress, regulate blood pressure and control inflammation. It also known as stress hormone. This cortisol controls a variety of vital functions in the body, including metabolism and immune response. It plays a vital role in assisting the body's stress response. Children, let us discuss how this cortisol hormone works. The pituitary gland in the brain regulates how much cortisol the adrenal gland releases. When you are stressed, the pituitary gland signals the adrenal glands to produce more cortisol. Cortisol's levels fluctuate throughout the day. Children, let us see how does it works. It helps the body respond to stress and danger, and it helps to control blood pressure. It helps to regulate the blood sugar and also regulate the metabolism. It also helps to regulate the sleep awake cycle and controls the inflammation. It also helps to regulate the immune system. Children, now let us discuss when cortisol levels are too high or too low, what happens. The high levels can lead to Cushing syndrome, which can cause a rapid weight gain, high blood pressure and osteoporosis. The low levels of cortisol can lead to Addison's disease, which can cause fatigue, dizziness and weight loss, etc. Children, let us discuss how this can be measured. The cortisol levels can be measured in blood, urine, saliva or hair, and the treatment is cortisols like compounds called corticosteroids are sometimes used to treat cortisol related diseases. Children, now let us discuss about dihydropendosterone sulfate, which is also called DHEA. The DHEA is secreted by the adrenal gland, and it is a steroid hormone that is produced in the adrenal gland and is a building block of the hormones testosterone and estrogen. It is a weak androgen but can be converted to more potent androgens in the body. The DHEA is a male sex hormone that both men and women produce. DHEA is required for the production of both the male and female sex hormones, testosterone and estrogen. It also plays a role in the maturation of male sexual characteristics during puberty. Children, let us discuss how this DHEA works. DHEA is a building blocks of testosterone and estrogen, and it also regulates CBSE gland activity. It is used to paralytical drug in Japan to treat cervical dilations and ripening during childbirth. DHEA is a test measure the amount of DHEA in the blood. Blood is drawn from a vein, usually from the back of the hand or inside the elbow. Children, let us discuss how does it change the age. This DHEAS levels in newborns are high but falls to prepubertal levels within a few days. DHEAS levels increase during adolescence around the age 7 to 9 and continue to increase until the third decade of life. These DHEAS levels can start to decrease, reaching an amount of 20% of the level at high age 25 by age 30. Related conditions like women with adrenal insufficiency have low levels of DHEAS. Lower than normal levels of DHEA in older people have been associated with osteoporosis, heart diseases, memory loss, and breast cancer. Children, now let us discuss about the pancreas gland. The pancreas is a gland in the abdomen that plays a key role in digestion and blood sugar regulation. It's about the size of our hand and it is located behind the stomach. The pancreas is a digestive and endocrine system organ found in invertebrates. The pancreas is the largest endocrine gland in the human body. It is a gland that is found in the abdomen behind the stomach in humans. The pancreas performs both endocrine and digestive exocrine functions. It is an endocrine gland that regulates blood sugar levels by secreting the hormones insulin, glucagon, somatostatin, and pancreatic polypeptide. It works as an exocrine gland in the digestive system, secreting pancreatic juice into the duodenum through the pancreatic duct. Children, let us discuss about digestion. The pancreas produces pancreatic juices or enzymes that break down fats, sugars, and starches. These enzymes travels through ducts and empty into the duodenum, the first part of the small intestine, and the pancreas also produces lipase, which works with bile to break down fat. Blood sugar regulation, and the pancreas produces hormones like insulin, glycogen that regulate blood sugar levels. These hormones also stimulate stomach acids and tell the stomach when to empty. Children, let us discuss the parts of pancreas. The pancreas has 5 main parts: the head, neck, body, tail, and urinate process. The head is the wide end of the pancreas on the right side of the body. The tail is the thin end of the pancreas on the left side of the body. Children, let us discuss the diseases of pancreas. The pancreatic disease can be hard to diagnose because of a pancreas location. Most cancers of the pancreas start in the digestive enzymes part of the pancreas. Children, now let us discuss about glucagon. The glucagon is secreted by the pancreas. The glucagon induces glucose synthesis, prevents glucose dehydration, and facilitates the conversion of glycogen to glucose in the liver. The glucagon is a hormone that increases blood sugar levels. It produces in the pancreas and released by the alpha cells of the pancreatic islets. Glucagon is used to treat low blood sugar and is also used in diagnostic tests. Children, let us see how this glucagon works. Glucagon is released when blood sugar levels are low, a condition called hypoglycemia. Glucagon causes the liver to release stored sugar into the blood. Glucagon is an antagonist to insulin, which means it increases blood glucose. Let us discuss the other functions of glucagons. This glucagon also plays a role in hepatic lipid and amino acid metabolism. Glucagon may increase resting energy expenditure. Glucagon may also play a role in appetite regulation. Let's see the medicine for this glucagon. Glucagon is used as a medicine to treat low blood sugar in people with diabetes. Glucagon is also used in diagnostic tests of stomach and other digestive organs. Now let us discuss about insulin. The beta cells of pancreatic islets of Langerhans secretes the peptide hormone called insulin. Insulin regulates the blood glucose levels by facilitating cellular glucose absorption, controlling carbohydrates, lipid and protein metabolism, and promoting cell division and growth through its mitogenetic effects. Insulin is a hormone that helps regulate blood sugar levels. It is produced by the pancreatic and released into the blood when blood sugar levels arise. Insulin helps glucose enter cells where it can be used for the energy or stored. Let's see how these insulins work. The pancreas is produced insulin in response to high blood sugar levels. Insulin binds to receptors on cell membrane, allowing glucose to enter the cells. Glucose is used for energy in the cells or stored for later use. Insulin also helps to break down fats and proteins for energy. Now let us discuss the types of insulin. The rapid acting insulin. Rapid acting insulin starts working within minutes of injection, and short acting insulin it starts working within 30 minutes after injection. Intermediate acting insulins it start working about 60 to 90 minutes after injection, and long acting insulin slowly releases insulin over a long period of time. And next one is mixed insulin. Mixed insulin, a combination of rapid acting or a short acting insulin and intermediate acting insulins. Children, let us see insulin and diabetes. If the pancreas does not produce enough insulin of the immune system attacks the insulin producing cells, or if the immune system attacks the insulin producing cells, blood sugar levels can become too high or too low. This can lead to type 1 diabetes, which requires regular insulin injections. Children, now let us discuss about estrogen. Estrogen is secreted by the ovaries in females. Estrogen is a hormone that plays a vital role in sex and reproductive development in women. It also helps maintain bone and heart health and affects mood, skin, and other tissues. Estrogens are involved in ovarian function such as the maturation of a ovarian follicle as well as a vaginal and uterus maturation and maintenance. Estrogens play a key role in the regulation of gonadotropin secretion. Children, now let us see what does this estrogen do. Reproductive development. Estrogen helps and maintains female sexual characteristics such as breast and pubic hair. Menstruation cycle. During reproductive years, estrogens regulate the menstruation cycle. Bone health. Estrogens helps the maintenance of bone health, and estrogens helps the maintenance of heart health. Mood. Estrogens can affect mood, including mood swings, irritability, and anxiety. Skin health. Estrogens can affect skin health during dry skin. Children, now let us discuss what are the different types of estrogens. First one is estrogen E1, the primary form of estrogen after menopause, and second one is estradiol E2, the primary form of estrogen during reproductive years. Third one is estrosol E3, the primary forms of estrogen during pregnancy. Children, let us see what happens if estrogen levels are too high or too low. If the estrogen levels are too high, can cause bloatings, headaches, hair loss, high blood pressure, and blood clots. And if the estrogen levels are very low, can cause dry skin, tender breast, hot flashes, night sweats, and moodiness. Now let us discuss about progesterone. The corpus luteum in the ovary secretes the progesterone hormone. The progesterone hormone is an important for sustaining the earlier stages of pregnancy and the menstruation cycle. It may also play a role in the progression of some cancers. It's also used as a medication to treat a variety of conditions. Children, let us see how does this progesterone do. The menstruation cycle, progesterone helps regulate the menstruation cycle. In pregnancy time, the progesterone helps the lining of the uterus grow and accept the development of the baby. It can also help preventing miscarriages in some women. Let's discuss how this hormone functions in menopause. In menopause, progesterone is used in a hormone therapy to treat symptoms of menopause such as hot flashes and vaginal dryness. Birth control. In birth control, progesterone hormone can be used as a form of birth control. Infertility, it can be used as treat of infertility. Now let us see how does it used. Progesterone is available as per prescription medication in the form of capsules or liquid pills. Progesterone is often used in combination with estrogen. The side effects of these hormones includes headaches, breast tenderness, upset stomach and mood swings. Children, now let us discuss about gonad. A gonad, also known as a sex gland or reproductive gland, is a mixed gland that contains an organism's gametes, means sex cells and sex hormones. Two key hormones are related by the female ovaries, which are found in the pelvic cavity. Under the influence of follicle stimulating hormone, the ovarian follicles begin to secrete estrogens at puberty. Estrogens promote the production of secondary sexual characteristics and the maturation of the female reproductive system. Progesterone is produced in response to high luteinizing hormone levels in the blood. It helps to regulate the menstruation cycle by the interacting with estrogens. Children, let us discuss about testosterone. Testosterone is secreted by multiple glands, ovaries, testes, and adrenal. Testosterone is a sex hormone with many functions in the body. It's thought to control libido, bone density, fat distribution, muscle mass and strength, and red blood cells and sperm production in men. A small amount of testosterone in the bloodstream is transferred into estradiol and estrogen-like substance. Thank you.